Greetings, this is Dr. Sandra Cabot. This video is about the fascinating subject of parasites that infect humans. The liver is an attractive destination for many parasites. The liver is an immunotolerant organ and thus is an easy place for parasites to hide from the immune system. Parasites have a large range in size. Injury to the person infected by parasites can vary from minimal to lethal. Parasites can inhabit the liver or pass through the liver during their normal development and can cause destruction of liver tissue. Parasites in the liver and gut cause significant global disease and death, as they can lead to gallbladder disease, liver cirrhosis, liver failure, and some types of cancer. I have done 4 videos on parasites as it's a big subject. Let's look at some of the parasites that infect humans and how you can detect if you are infected. We will also discuss how you can effectively treat parasites before they destroy your health. Let's start with large parasites, known as multicellular complex organism parasites. Larger parasites can inhabit or transit the bile ducts and the portal blood vessels, which bring blood from the intestines to the liver. Worms. Let's start with tapeworms. Tapeworms are flatworms that have a head, neck, and many body segments. An adult tapeworm can become very long and live in the intestines for many years. Doctors in India removed a pork tapeworm, Taenia solium, from a patient's intestine which was nearly 2 meters long. The fish tapeworm, Diphyllobrium latum, can inhabit the intestine of fishes and humans and can reach a length of 12 meters, but can exceptionally grow to 18 meters in length. Scary. Echinococcus is a disease caused by a parasitic tapeworm and is more common in the Middle East, the Mediterranean, Africa, and Central Asia, but is also increasing in Europe. If untreated, Echinococcus can be fatal. Infection with tapeworm eggs causes cysts to form in vital organs such as the liver and lungs. Rarely, the tapeworm cysts can infect the brain. The tapeworm, called Echinococcus granulosus, is found in dog feces and can cause Hydatid disease in humans. Hydatid disease causes fluid-filled cysts in the liver or lungs, but can grow in any organ including the brain. The tapeworm lives in animals such as dogs, sheep, cattle, and goats, and you can contract an infection if you eat food contaminated with animal feces. You can also get infected with a tapeworm by eating raw or undercooked beef, pork, and fish. Wash fruits and vegetables grown in areas where tapeworm is common. The symptoms of tapeworm infection. Symptoms can include nausea, loss of appetite, abdominal pain, dizziness, headache, allergic symptoms, hives, skin rashes and itching, diarrhea, unexplained weight loss, fatigue, and deficiencies of vitamins and minerals. You may not have any symptoms, and the tapeworm may exit your body on its own. Tip: always check your feces for tapeworm parts. Diagnosis of a tapeworm infection. Feces test. Microscopy of a stool sample in a laboratory is done. The identification of specific tapeworms infecting humans is difficult to perform just by looking under a microscope. This identification is not critical, as effective drugs work across a wide range of different tapeworms. The new test, called PCR, also known as molecular analysis and sequencing, represents the only reliable tool to identify these parasites to the species-specific level. This is usually not done and is not needed to choose the correct treatment. Imaging tests can be done to look for cysts in organs such as the liver and lungs, and may be needed and include CAT scans, MRI scans, or ultrasound scans. Blood tests can be used to confirm a diagnosis and may show immune system antibodies to the larval cysts or elevated levels of an immune protein called IgE. The treatment of tapeworm. Infection is treated with anti-parasitic drugs such as mebendazole, albendazole, praziquantel, or nisoxanide. You can easily kill tapeworms with these drugs. Treatment is about 95% effective and typically only takes a few days. Your doctor may prescribe a 2-dose treatment of these drugs to help you clear the infection. The second dose of medication is typically given 2 weeks after the first dose. You should have other family members tested. The drug praziquantel is popular because it also paralyzes the worm, forcing it to dislodge from your intestinal wall. These drugs kill the tapeworm, but not the eggs. Washing your hands well with soap and water after using the toilet protects you and other people from the spread of tapeworm eggs. Your doctor will schedule follow-up appointments and test stool samples to see if the treatment has worked. Follow-up feces tests are very important. Now let's look at roundworms. Ascaris is an intestinal parasite of humans and is a type of roundworm which has a special affinity for the liver. Ascaris is the most common roundworm to infect humans, and currently around 800 million people worldwide are infected with Ascaris lumbricoides. Ascaris is linked to low socioeconomic conditions, poor hygiene practices and sanitation, which promotes the parasitic life cycle. Ingestion of food or water contaminated with mature eggs from human feces is the main route of infection. The life cycle of Ascaris worm. These worms are parasites that use your body as a host to mature from eggs to adult worms. Mature Ascaris worms can be more than a foot long. Adult worms develop in the small intestines and produce eggs which are released into the environment in the absence of a sewage system. After maturation in the soil, eggs can contaminate plants which serve as a source of infection. Ascaris larvae hatch in the small intestine and migrate to the liver and lungs. In the lungs they are coughed up and swallowed, again reaching the digestive tract. Symptoms of Ascaris infection. During larval migration, respiratory symptoms such as cough or chest pain may occur. In heavy Ascaris infestation, a mass of worms can block a portion of your intestine. This can cause severe abdominal cramping and vomiting. The blockage can even make a hole in the intestinal wall, causing internal bleeding or appendicitis. Worms may block the narrow ducts of your liver, gallbladder, bile ducts or pancreas, causing severe pain, or an infected gallbladder with fever and jaundice. Ascaris eggs are carried via the portal veins into the liver and are trapped there in the liver tissue. An inflammatory granuloma develops around the eggs in the liver. If the egg load is high, fibrosis of the liver may finally develop, leading to liver cirrhosis. Complications of Ascaris are related to the quantity of worms and location of the large worm. They include abdominal pain, bleeding from the gut, small bowel obstruction, acute gallbladder pain and infection, acute pancreatitis and liver abscess. Ascariasis is a serious and potentially fatal disease. Diagnosis of Ascaris infection. A stool sample is examined with a microscope to look for the presence of Ascaris eggs. A worm may be passed into bowel action or coughed up. The treatment of Ascaris infection. The drugs albendazole, mebendazole and ivermectin are very effective for the treatment of ascariasis, and often a single dose is all that is required. Almost all parasites count as food and waterborne diseases. Therefore, long-term control requires an integrated approach, combining early diagnosis by educating doctors, individual treatment, public health measures, food chain safety, and animal health interventions for diseases with animal reservoirs. Although parasites cause a significant global burden of disease, treatment can be very effective. Vaccines are not expected to be available soon. Awareness, prevention, and early recognition and treatment are the keys to success. So some final tips. Check your feces after your bowel actions to make sure you don't find any surprises. Wash your hands thoroughly with hot soapy water, as this kills most germs, including parasites. This is so important after handling animals and soil and before handling or eating food. Boil your drinking water. If you have persistent symptoms of irritable bowel or unexplained symptoms of poor health, have your feces checked for parasites. Well, thanks for listening, and I hope I haven't scared you too much. But as you can see, drug treatment of parasites is very effective. And often the problem is just that nobody looks for the parasites. It's very important to make an early diagnosis, because treatment will be very effective and prevent the complications of these nasty parasites. So, thanks for listening, and if you enjoyed the video, click like and subscribe.